Welcome to the module on group work in different settings, group work in health settings. Learning objectives. The module will provide a basic understanding to the learner about group work in health settings and the functions of the social worker in any healthcare setting. The module will also provide an opportunity to the learner to understand the issues addressed in such groups and the skills essential for a social group worker in healthcare settings. Introduction. Social workers employed in healthcare settings wear multiple hats: case managers, patient navigators, psychotherapists, and community outreach coordinators, to name a few. Social workers are often the bridge that connects primary and behavioral health care. In these environments, social workers identify psychosocial problems that are often overlooked or go unnoticed in other healthcare practitioners. Social work practice in an outpatient setting involves multiple methods, including clinical and macro approaches, as well as policy and advocacy. Key functions and tasks performed by a social worker in healthcare settings. Social workers in a healthcare setting deliver services that touch all areas of their patients' lives. According to Gibbelman and Grobman, the key functions performed by a social worker in healthcare settings are as follows: identification, assessment, and treatment of mental health conditions such as depression and anxiety. Case management or care coordination, particularly for individuals with chronic and or complex medical conditions. Patient navigation, especially for patients moving among different healthcare levels, example, inpatient, outpatient, home health, or long-term care. Identification and referral for specialized services such as drug and alcohol treatment, legal services, financial and employment counseling, and housing support. Education and support programming, example, diabetes education, parenting classes, stress management for individuals and groups. Assistance with entitlements, medication, transportation, and advance directives. Assessment and intervention in domestic violence and child abuse situations. Counseling on end-of-life issues. Outreach and coordination with other community resources and agencies, and community-level advocacy on behalf of patients and families. Social workers appear in public health, acute and chronic care settings, providing a range of services, including health education, crisis intervention, supportive counseling, and case management. In response to critical incidents that are both global and national, healthcare social workers are increasingly trained to provide interventions to prepare for and respond to traumatic events and disasters. The healthcare system is complex and multidisciplinary in nature and may include a network of services such as diagnosis, treatment, rehabilitation, health maintenance, and prevention provided to individuals of all ages with a range of needs. Professional social workers are well equipped to practice in the healthcare field because of their broad perspective on the range of physical, emotional, and environmental factors that have an effect on the well-being of individuals and communities. The basic values of social work, from promoting an individual's right to self-determination to having an attitude of empathy for the individual, are the foundation of social work practice in health settings. When confronting dilemmas or needs in healthcare, social workers can use the principle of client self-determination in matters where clients or their families are faced with such issues. Core values embraced by social workers in healthcare settings. The core values embraced by social workers throughout the profession's history are the foundation of social work's unique purpose and perspective. Service, social justice, the dignity and worth of the person, the importance of human relationships, integrity, competence, and structural factors that affect healthcare systems. From the time of its evolution and growth, group work has diversified as a method of social work practice. It has traveled and spread beyond traditional areas as well. List of settings in which group work is practiced in healthcare settings: medical hospitals, psychiatric hospitals, de-addiction centers, rehabilitation centers, palliative care centers, geriatric care centers, child guidance centers. Group formation. Group formation refers to the ways in which groups come into being. Group formation can be understood in 3 different ways, according to Ken Heap, based on the degree of volition on the part of the members. The 3 types of group are compulsory groups, formed groups, and natural groups. Those groups which are formed by some external agency through the exercise of authority can be called compulsory groups. Many alcoholic and drug treatment institutions and an increasing number of psychiatric hospitals require patients or inmates to attend group treatment sessions of various kinds, regardless of their choices. These are examples of compulsory groups. Though formed groups are formed by external initiatives, the members have more choice. They select the group themselves, since they may accept or refuse the invitation from a group worker. For example, a social worker motivates a group of parents of differently abled children to come together in order to help each other to work through their problems, feelings, and decisions. They may or may not choose to enter the group situation. The natural group, on the other hand, arises spontaneously without any external initiative or compulsion. The members simply come together through circumstances which often seems to involve a large element of chance. For example, a group of teenagers who involve in shoplifting in order to finance alcohol purchase, or a group of street children operating or residing in the same locality. The kind of group formation has a direct relevance to the practice of social group work. Experience suggests that the conditions of formation exert substantial influence on the members' attitude towards the group, on their readiness to identify with its objectives and with each other, and even with the agency and the worker. Rationale for group work in health settings: therapeutic factors. Levin's law of change states that it is usually easier to change individuals formed into a group than to change any of them separately. In healthcare setting, groups have not only effective changes but a therapeutic effect also. Yalom suggested that therapeutic change is an enormously complex process and occurs through the intricate interplay of various guided human experiences, which he called therapeutic factors. These therapeutic factors are much higher in a group working in a health setting. This makes social group work a powerful method. The following are some therapeutic factors. First, installation of hope. the members will be able to experience a new hope in their life due to the group experience. Each member will be inevitably at a different point on the coping continuum. Watching others cope with and overcome similar problems successfully instills hope and inspiration. Second, universality. Many members enter groups with the thought that they are unique in their problems of life, that they alone have certain frightening or unacceptable health problems. The group experience helps the members to understand that they are not alone in experiencing these problems. Third, information giving. The group becomes a platform for the members to learn about the illness they share. So also, the group experience helps the members to recognize the variations in the illnesses. Fourth, altruism. Patients have probably less to offer others and much to take from the group members. Consequently, they tend to feel inadequate. The group offers the members to be of help to other members, even if it means merely methods discussed in the group about anger management, activity scheduling, money management, and so on. Helping others is a powerful therapeutic tool that greatly enhances members' self-esteem and feeling of self-worth. Fifth, corrective recapitulation of the primary family. Most group members who seek treatment would have interpersonal problems at the family level for long periods. Group members start identifying the group as their family. Thus, the authority figure, the worker, becomes the head of the family, and other active members in the group become the dear ones in the family. The group serves the function of a family to these members with its own rules, coalitions, affection towards other members in the family. This recasting of the family of origin gives members a chance to correct dysfunctional interpersonal relationships in a way that can have a powerful therapeutic impact. Second, improved social skills. Groups act as a smaller unit of society with a number of other members who have their own behaviors, beliefs, and attitudes. Members learn to relate to other group members in appropriate ways and frequently also get feedback about their interaction. While the feedback can be anxiety-provoking, the directness and honesty with which it is offered can provide much needed behavioral correction and thus improve relationships both within and outside the group. 7. Imitative behavior. Members model behaviors learnt in the group from the therapist and other group members, within the group and outside the group. Over time, members pick up these behaviors and incorporate them. 8. Interpersonal learning. Our lives are characterized by intense and persistent relationships, and much of our self-esteem is developed via feedback and reflection from significant others in our life. Distortions in the way we see others often damage even our most important relationships. Group work helps individuals in learning to relate well with each other. 9. Group cohesiveness. Belonging to a group of any nature is one of the most basic human needs. Prior to the disease conditions, people who entered groups may not have experienced success as group members. Groups in the healthcare setting help them in feeling truly accepted and valued for the first time. This can be a powerful healing factor as the individuals replace their feelings of isolation and separateness with a sense of belonging. 10. Catharsis. It is the release of conscious or unconscious feelings followed by a feeling of great relief. It is a type of emotional learning as opposed to intellectual understanding that can lead to immediate and long-lasting change. Groups provide a fertile ground for catharsis as it evolves around an empathetic atmosphere. 11. Existential factors. There are certain realities of life, including loss, isolation, freedom, meaninglessness, and death. The fact that one must take ultimate responsibility for the way one lives his or her life is an existential truth. Skills essential for a social group worker in a healthcare setting. First, planning and preparing the program for the group. Second, creating a rapport and establishing a relationship. Third, welcoming skills. Fourth, empathy. Fifth, role of self-knowledge and intuition. Sixth, open questions. 7. Closed questions. 8. What questions. 9. Circular questions. 10. Paraphrasing. 11. Clarifying. 12. Summarizing. 13. Giving and receiving feedback. 14. Sticking to the point and purpose of the interview. 15. Prompting. 16. Probing. 17. Allowing and using silences. 18. Using self-disclosure. 19. Ending an interview. 20. Termination of the group. 21. Giving advice. 22. Providing information. 23. Providing explanations. 24. Offering encouragement and validation. 25. Providing reassurance. 26. Using persuasion and being directive. 27. Providing practical and material resources. 28. Modeling and social skills training. 29. Reframing. 30. Offering interpretation. 31. Adaptation. 32. Group counseling skills. 33. Containing anxiety. 34. Empowerment and enabling skills. 35. Negotiating skills. 36. Contracting skills. 37. Networking skills. 38. Working in partnership. 39. Mediation skills. 40. Advocacy skills. 41. Assertiveness skills. 42. Being challenging and confrontative. 43. Dealing with hostility, aggression and violence. 44. Providing protection and control. 45. Managing professional boundaries. 46. Record keeping skills. 47. Reflective and effective practice. And 48. Using supervision creatively. Issues addressed in groups in a health setting. The practice of group work in various settings involves discussions on various issues. The agency setting where the group work is practiced and the target group determine the issues which will be addressed in the group work sessions. For example, the issues addressed in group work with the elderly will address old age issues ranging from financial burden to illnesses in geriatric conditions. Topics addressed in group work with people with psychiatric morbidity. Expectations and needs of the patients and family members. Psychoeducation, information about the illness, signs, symptoms, cause, etc. Treatment modalities, investigation, readaptation issues after discharge. future concerns such as marriage, having children, when on medication, etc. Relapse prevention strategies. Training in various skills, which includes social skills, assertiveness skills, interpersonal skills, life skills, etc. Follow up through groups. Group work practice in residential and inpatient settings is quite popular and is generally seen to be practiced. An offshoot of the group work practice in hospital settings has led to the evolution of group work in outpatient settings too. This can also be referred to as follow-up through groups. Such groups have certain inherent advantages and disadvantages. Advantages. First, members are coming from their homes and not institutional settings, which means they are in real world situations as they will be interacting with their family members on a daily basis. The problems they will report are much nearer to reality than the imaginative, futuristic problems dealt with in institutionalized or protected settings. Second, members are able to field test the suggestions which the group provides by the next follow-up and provide feedback in the next sessions. Third, the rate of follow-up tends to increase because of the continuing advantage of the therapeutic factors in group work. A follow-up is not just an event for meeting the social worker, but also meeting the other members who are sailing in the same boat. Fourth, issues such as compliance to medication, lapse and relapse, dealing with anger, dealing with emergencies are more effectively dealt with in follow-up groups than in individual follow-ups. 5. To the hospital staff, it is a time economizing task as follow-up groups involve 8 to 10 patients who come together at a time. 6. Most often, these groups include both the patients and their family members, which gives an opportunity for both of them to understand the other's perspectives. Disadvantages. First, often the follow-up groups turn out to be bilingual or much worse, multilingual, which makes communication very difficult. Second, maintaining time will evolve as a difficult issue as different members may turn up at different times. Third, the group worker has to be excessively careful and vigilant not to have actively psychotic or excessively disturbing and weak or bedridden patients in the group. Fourth, difference in the age group of the patients can result in a dilemma in program media selection, program planning and implementation. Fifth, follow-up groups at times become battlegrounds for the members as well as the family members to complain about each other. Keeping in view the advantages and disadvantages, it is important to know that conducting follow-up groups requires considerable skills and experience because of the dynamics occurring, the characteristics of the members, the issues that may arise, etc. Recording in social group work. Maintaining records occupies a central place in social work in general and particularly in group work in health settings. Recording in group work means writing the description of the individual's activities and his or her relationship with the group, behavioral pattern of the members, responses to one another, type and extent of participation, movement, growth, role in group processes, etc. are recorded. Significance of recording in group work. Records help the worker to understand the members in the group, to understand the group as a whole, provide evidence of growth and changes in the members and in the worker, helps the worker to work more effectively with the group on the basis of information in the record. The worker can see merging and changing interests of individual members, helps the social worker to observe the development of skills and social attitudes in the group members, can gain knowledge of a special problem in the group, can understand the emergence of group consciousness, provides content for supervisory conferences, a source for future planning, a source of information for other workers. Records provide a permanent and continuous register of facts for the agency. Contents of the record: identifying information of the group, members' participation by name, description of the group as a whole, description of the group problems, the relationship and the role of the group worker, special assistance given, and evaluation. A typical group work session. Within the realm of health, we have different settings. Particulars such as number of sessions, duration of each session, what will be discussed during a session, etc., will differ depending on the clientele. Provided below is an example of a typical group work session carried out in an Alcoholic Anonymous AA group of people with alcoholic dependence. Start by greeting the group. Introduce each member, including the family members if any. Comment on the weather of the day or the dominant mood of the group so as to make the atmosphere of the group lighter. Elicit responses about the previous session. Ask for any lessons learned. Check any assignments given in the previous session. Light energizing games can be used here. Introduce the topic for the day. Example: what is relapse? Has any member experienced a relapse? What happens to self and family on relapse? Why do people generally relapse? Ask for the relapse story. Ask what others will do in case of relapse. Conclude with ways to prevent or manage relapse, which will include all those methods the group members discussed. Give an assignment for the day. Summarize the day. Other activities like role plays, debates, motivational videos, etc. can be used. Conclusion. It is essential that group work is taught not only in classrooms but also in field work with appropriate supervision and guidance rather than as a mere component of the syllabus. Ideally, patients in groups leave with a better understanding and acceptance of themselves, stronger interpersonal and coping skills. Some individuals continue in therapy even after the groups disband, either individually or in another group setting. Summary of this module. In this module, we discussed social group work practice in health settings. We also discussed key functions performed by a social worker in any healthcare setting and the skills essential for a social group worker in this setting. Finally, we also dealt with issues addressed in groups in a health setting. Thank you for attending this session.